Cindy is a 38-year-old woman originally from Ontario but now living in Sackville, Nova Scotia with her family as a result of her husband's employment at the Halifax Naval Base. She has been married for 15 years and has 2 children, Sally, 8 years of age, and Henry, 11 years of age. Her husband, Jordan, is a Navy officer and works offshore for extended periods of time. Jordan returned home 4 months ago after a 6-month deployment and informed Cindy that he had been laid off, most likely indefinitely. For the past 10 years, Cindy has been working as a teller at Scotiabank on Robie Street in Halifax, Nova Scotia. The news of her husband's job loss has been financially stressful and has created additional stress in all areas of Cindy's daily life. After being confronted by both her husband and supervisor, Cindy decided to seek help. She scheduled an appointment with her family physician, who recommended her to an occupational therapist.
Since her mid-20s, Cindy stated she has been smoking cannabis recreationally and in the past has enjoyed a casual glass of wine after a long workday. However, with the additional stress in Cindy's life, as per husband's job loss, she has significantly increased her use of cannabis and alcohol. Cindy stated that she now has at least 5 drinks on a daily basis. She has also increased her cannabis use to twice a week, often when Jordan has the children at recreational activities. In turn, Cindy is experiencing increased agitation, anxiety, difficulty with problem solving at work, and a strained relationship with her husband and children. In her initial meeting with the occupational therapist, multiple occupational performance issues were identified. Number 1, failure to complete assigned tasks at work. Number 2, difficulty initiating and maintaining self-care tasks such as personal hygiene. Number 3, failure to complete daily home maintaining and parenting duties such as meal prep, laundry, cleaning, assisting with homework, and attending children's after-school activities.
The ASSIST is an 8-item questionnaire intended for use as an interview between a healthcare worker and a client or via self-administration. The test takes approximately 5 to 10 minutes to administer. It is recommended that examiners have formal training for effective implementation of the test. The test creates a numerical risk score for a client's non-prescribed use of tobacco products, alcohol, cannabis, cocaine, amphetamine-type stimulants, hallucinogens, inhalants, and/or other drugs, based on client responses. In general, the ASSIST has high clinical utility and is available at no cost. It provides clear and comprehensive instructions and scoring sheets, accessible through the World Health Organization's website. The ASSIST is also accessible to a broad range of populations, considering its low cost, time efficiency, and transportable nature. The ASSIST is also intended for standardized international use. This test was found to have high construct, concurrent, and discriminative validity for adults ages 18 to 60 years. The test has good test-retest reliability in a primary care population, although it has not been validated for individuals under the age of 18.
The ASSIST questionnaire can be administered by an interviewer or through self-administration. After reviewing confidentiality, the client is given a response card which lists the drugs the test evaluates and explains the frequency response options. Example, once or twice, 1 to 2 times in the last 3 months, etc. The ASSIST manual contains instructions to guide the interviewer, as they may need to rephrase some questions and/or provide prompts leading to more accurate responses.
So here you go, Cindy. Here's your response card.
Okay.
So the following questions ask about your experience of using alcohol, tobacco products, and other drugs across your lifetime and in the past 3 months. These substances can be smoked, swallowed, snorted, inhaled, or injected. Some of the substances listed may be prescribed by a doctor, like amphetamines, sedatives, or pain medications. For this interview, we will not record medications that are used as prescribed by your doctor. However, if you've taken such medications for other reasons other than prescribed, please let me know, or if you've taken them more frequently or at a higher dose. While we are also interested about your use of various illicit drugs, please be assured that the information on such use will be treated as strictly confidential. Are you comfortable moving forward?
Yep.
Okay, Cindy, question 1. In your life, which of the following substances have you ever used? Non-medical use only. Tobacco products, such as cigarettes, chewing tobacco, cigars. Alcohol beverages, such as beer, wine, or spirits. Cannabis, such as marijuana, pot, grass, or hash. Cocaine, coke, crack, etc. Amphetamine-type stimulants, such as speed, meth, or ecstasy. Inhalants, such as nitrous, glue, petrol, or paint thinner. Sedatives or sleeping pills, such as diazepam. Hallucinogens, such as LSD, acid, mushrooms, or ketamine. Opioids, such as heroin, morphine, methadone, codeine, etc., or any other drugs.
I've used alcohol and cannabis.
Okay. Okay, Cindy, so as you can see for questions 2 to 6 on your response card, there are certain answers. These are never, once or twice, monthly, weekly, daily, or almost daily. Okay? So question 2, in the past 3 months, how often have you used the substances you mentioned? So alcohol and cannabis.
Okay, alcohol would be daily or almost daily, and cannabis on a weekly basis, I'd say.
Okay. So question 3, during the past 3 months, how often have you had a strong desire or urge to use alcohol or cannabis?
Alcohol daily, for sure, and cannabis almost daily.
Okay. Question 4. During the past 3 months, how often has your use of alcohol and cannabis led to health, social, legal, or financial problems?
Health, social, legal, or financial problems? Okay. Alcohol, I'd say weekly, and cannabis never.
Okay. Question 5. During the past 3 months, how often have you failed to do what was normally expected of you because of your use of alcohol or cannabis?
Alcohol, I'd say again on a weekly basis, and cannabis never.
Okay. Question 6. Has a friend or relative or anyone else ever expressed concern about your use of first drug or second drug?
Okay, so alcohol and cannabis.
Alcohol and cannabis.
Okay, I would say yeah, in the past 3 months for both of them.
Okay.
Yeah.
And question 7. Have you ever tried to cut down on using alcohol or cannabis, but failed?
Alcohol, no, never.
Okay.
And cannabis, yes, but not in the past 3 months.
And the last question, question 8. Have you ever used any drug by injection, non-medical use only?
No, never.
No, never.
The first 2 questions of the questionnaire are filter questions which indicate if you shall proceed with the questionnaire or if the test should be terminated. If the test proceeds beyond the first 2 questions, the interviewer will calculate the client's score for the remaining 6 questions. The interviewer must circle the numerical score that corresponds to the client's responses on questions 2 to 7 for each individual substance. Once the scores are summed for each substance, the scoring then transfers to low, moderate, or high risk categories, which are used to determine appropriate interventions or referral.
Okay, Cindy. Based on the assist, your alcohol score was a 31. This score indicates that you are at a high risk category and you require the most intensive treatment. This means that you are at a high risk of experiencing severe problems, including health, social, financial, and legal and relationship problems, as a result of your current pattern of use and are likely to be dependent. Based on the assist, your cannabis score was a 23. This score indicates that you are in a moderate risk category and require a brief intervention. This means that you are at moderate risk of health and other problems from your current pattern of substance use.
After reviewing the assessment findings, Cindy and the OT determined the following goals. April 1st, 2018, Cindy will have attended 10 weekly Alcoholic Anonymous meetings. By April 1st, 2018, Cindy will have completed 75% of required daily tasks assigned at work. While the screening tool does not have the advantage of focusing on a broad range of substances, it does not target specific occupational performance issues, but rather focuses on generalized problematic areas. The option for self-administration can prove to be advantageous as it allows the client to respond more honestly to the questions as they are not influenced by an interviewer's tone of voice, paraphrasing, or stigmatizing behavior. Disadvantages of this method of administration is that it is not feasible for individuals with low literacy or visual impairments, and it eliminates the potential for practitioners to develop rapport with clients during the assessment process. Overall, the ASSIST is a quick, self-administered, or guided test that should be used to screen individuals ages 18 to 60 for detrimental substance use in primary care settings. While this test can provide surface-level information, it is imperative that the occupational therapist or other healthcare professionals perform more in-depth assessments to gather sufficient information.